So how do you treat it if you do have it, or if you have weak bone osteopenia? Exercise, drugs, supplements. Exercise is the primary way. I showed you a wall sit and a modified wall sit here for a reason. You can do squats and deadlifts with heavy weights like I've showed you, but most of us aren't going to be capable of that, particularly if you've already got osteoporosis. So these are simple ways to begin to build bone, to begin to do resistance training and build muscle. As you get really good at the wall sit, you can do what's called a progression and begin to hold a weight while you do the wall sit. And eventually you're going to be able to do a deadlift. Eventually you're going to be able to do a back squat, a front squat, et cetera, et cetera. Exercise is your primary weapon against osteoporosis. Drugs. We're going to talk about drugs. Supplements. So 1,200 milligrams of calcium, I believe, is what we should all be taking on a daily basis, particularly women. Calcium citrate is 21% elemental. I put calcium citrate because it's easily absorbed in the system into our connective tissue multi. I take it every day personally. So 1,200 milligrams of calcium daily. D3, the optimal level, most people in exercise science, most people that are interested in anti-aging and wellness will tell you that 3,000 to 5,000 international units per day is your bare minimum. The government will tell you 400 to 800 international units is all you need based on the RDAs. So you decide which standard you want to go by. I go by the one for optimal bone health, wellness, and optimal aging. So I take about 4,000 international units a day of D3 with my 1,200 milligrams of calcium. Then K2, MK4 or MK7, you just want the active form. It's easier to get the one made from bacteria that's more easily absorbed and more bioavailable, the MK7. Magnesium, you want about 300 milligrams. Turns out magnesium also helps with muscle pain, restless leg syndrome, migraines, helps your nervous system work better. Why? Because it's all interconnected, like we talked about throughout this talk.